Hi.
Hi, how are
Hi,
you doing?
I'm good. It's so good. I'm so glad that you're here talking with us about narrative today.
Of course, I'm so excited. Thank you for having me.
Of course. Well, let me give the students a little background about who you are, and then you can obviously add in or fill in any blanks that I miss, if that's okay.
Sure, of course.
Okay, perfect. Okay, so Dr. Rajaei has a PhD in medical family therapy from East Carolina University. She's a licensed marriage and family therapist in California and North Carolina and is an AAMFT clinical fellow and approved supervisor. She's specifically trained in couples therapy and has vast experience in working with couples nationally and internationally. Dr. Rajaei has studied couples dealing with cancer and also works with them clinically. Professional interests include biopsychosocial spiritual stressors and conflicted intimate relationships, romantic relationship quality, family therapy, diversity, and social injustice issues, equity in healthcare systems, and medical family therapy. And Dr. Rajaei has published work on the lived experiences of immigrant couples and students, narrative therapy in couples facing cancer, the narrative approach to medical family therapy, and also the role of technology in sexual relationships.
That is
Any
true.
She's like, yes, fact,
I
that's
cannot
true.
prove that.
Is there
Thank you.
anything I forgot to add that you think would be valuable for us before we jump in?
No, I think that was good. The only thing that I would say, like on a personal level, is I'm from Iran and I moved here to the US to continue my graduate study, and then I happen to stay here. So now I'm here with
Okay,
you.
awesome. And you're in California, so you're
Yes,
okay, awesome.
sunny
Cool.
San Diego.
I've never been to California, so maybe we need to make this an annual thing and I just need to come out there.
You should come here in person and then we talk.
Okay, well, let's jump in. So I shared with you a little bit of background. We've been talking about narrative therapy for about a week now. We've read some articles, we've read some text. We kind of jumped into postmodernism and social constructionism and then hopped right into narrative.
Mhm.
The students have been able to see a couple videos, although they were recorded probably in the 80s, but they have been able to see some kind of recorded videos of what narrative therapy looks like in the therapy room to kind of
Mhm.
get some more context
Mhm.
and kind of bring to life some of the technique that we're talking about in our readings and
Mhm.
discussion. But really, the purpose of this is to kind of get to know somebody who's actually practicing narrative therapy and uses that lens as the expert. And so we have some questions we're going to go over and hopefully just kind of get to know you a little bit better and kind of what you see as kind of the benefit and how you utilize narrative therapy. So
Sure.
if we can kind of jump in, I wanted to just kind of first ask kind of what initially attracted you to the narrative model or approach.
So, fun fact about me, I love quotes. So from just the first quote that I saw about or I read about narrative therapy, that famous one, right? The problem is the problem, the person is not the problem. I felt like, wow, like this really resonates with me, and I love it. So, just not specifically about narrative therapy, but like in general, postmodern theories, I love that idea of reality is socially constructed and there's no
Mm-hmm.
absolute truth. So it's all about the way that we got socialized and the narratives and messages that we got from society. And as I mentioned, there's no absolute truths, right? So what I really liked about narrative therapy, and I still love, is that stories and narratives help us make sense of our experience. And our experience, I think that can be very different and at the same time very similar, right? So we all experience love, fear, excitement, all these different things, and at the same time our stories could be really, really different. I really like that narrative therapy is respectful, it's non-blaming. So a lot of times when I work with clients, I tell them that we are not looking for whose fault it is, we are looking for contributing factors, right? That just shift and in that framework, and how you kind of like talk about it. And I love, we have that mutual background in medical family therapy. So I love how narrative therapy is empowering and help clients to promote their agency and communion. And we can talk about it more as we move forward here, but that really empowering clients as expert of their experience and their lives, that part is super fascinating and exciting for me.
I love that. I also, as you were talking, I was thinking about how it fits so perfectly in a systemic lens because this idea of non-blaming, of taking in context, of recognizing that one identity isn't all identities, one problem isn't, and just kind of expanding the context. And that's kind of how I, as a non-expert in narrative therapy, view it. as
Mhm.
just kind of taking, like, we're kind of typically looking at one problem or one kind of isolated description of a person or experience, and how do we blow that up and kind of look at the rest of the context of the person and their experiences. And so it fits perfectly with the systemic lens, right? It
Exactly.
just feels so natural. So and you've kind of hit on this a little bit. What would you say is the benefits of narrative therapy?
Different things. So, as we were talking about narrative therapy and speaking of narratives, I feel like stories, they unite us. At the same time, as I mentioned before, we all have different and similar stories. And I think that narrative therapy is really powerful in promoting agency and communion, as I mentioned before. One of the concepts slash techniques that I really like about narrative therapy is that concept of externalization, right? And we have techniques and intervention on that. And I think that externalization is just so magical because it provides this space for clients, families, couples to see that this is me, this is the problem, and there's space here, and I have options. Because a lot of
Yeah.
times when we do personalize problems, when I am the problem, I am the lazy one, I am not loved, I am that person, then of course that I cannot do anything, right? Because I am the problem. But then we help clients with different techniques and externalization to see that you are you, the problem is the problem, and there's this space between you and the problem. So there's a difference between reaction and response. So a lot of
Yeah.
times when we react, we feel like we don't have any agency, we don't have any options. I had to say that, I had to do that, right? Because whatever happened, I was angry, blah, 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 right? But then when we help them to have that space, right, then I see that, okay, my reaction could be XYZ, but my response could be something else. Because when I think about it, when I see the problem outside myself, I could have also done, whatever. I could have
Mhm.
also said, whatever. So I have
Yeah.
options. I then
Yeah.
I see my agency, and my agency is promoted then. So I
Yeah.
really love that part about narrative therapy. So then clients and families, they can really see that autonomy and power regarding their lives and their decisions, right?
Mm.
And as a narrative therapist, I really want to engage clients as experts in their own lives, right? Because that is something that sometimes society does not do a good job in that, right? It's the
Yeah.
opposite, that you feel like, oh my God, I'm trapped here, I'm forced here, I have to do this, I have no
Mm.
options. And then besides that autonomy, the communion part, the part that I really want clients to feel like they're not alone on their journey. Because as we know, life is bittersweet, right? There are all these different beautiful things in life, but also there is pain and things that are not beautiful. I don't think that there is any glory in something like war, right? And we
Right.
all face those things in life, and they can be hard themselves in life, and then let alone that you feel like I'm just alone in this story. So helping clients with narrative therapy to feel like to reframing and reauthoring and talking about their preferred narratives, and helping them see that they're not alone. They have they have support, they have relationships that they can use and think of. I think that is really powerful and beneficial about narrative therapy. We can
Yeah, I
talk about
love
this
that.
more and more, but I'm going to stop.
I love that. And I love that, one of the things that we've talked about in as we're kind of laying out in this kind of postmodern lens is, they've learned about more modern approaches to therapy, and now they're learning about these
Mhm.
other approaches like narrative, solution focused, IFS. And so it's interesting because we keep kind of talking about this idea of as you're learning about these models, what feels natural to you? Like what language, as you're reading it, what kind of affirms how you feel and how you think about therapy conceptually, or how it makes sense of change, or your role as a therapist. And it's so obvious that narrative is like who you are. Like as you're
Mhm.
talking about it, it's so obvious that it's such a good fit for you naturally, that it's not just something that you do, but it's like something that embodies you, or you embody. So it's really cool to hear you talk about it. And I also want to piggyback and say that the idea of externalization is so powerful. Like even if like that's what you take away from narrative therapy, but just the idea of being able to externalize a problem, and for the therapist to allow space for different identities, right? And different experiences to come to light. When sometimes, a lot of times, I would say those problem identities are coming from external sources, right? Whether it's from our family, whether it's from society, whether it's from other kind of groups of power. And so being able to kind of empower the patient, I don't know if you all would use empower, but I just think it's such a powerful intervention to use for folks. So I'm so glad that you highlighted that. So speaking of, you had kind of mentioned this kind of expert piece in the role of the therapist. So what does it mean to be like not knowing? So this balance of, we have expertise, right? As MFTs, as MedFTs, we have a lot of specialized schooling and training, education, all of these things. So what does it mean to kind of walk in the room and say, I'm not an expert? And the kind of the difference, I guess, between like being an expert and how that looks in the room and that kind of thing. Does that make sense?
Yeah, a lot. I really love talking about it. So I think that it has to do with practicing that cultural humility concept, right? As a kind of like lifelong journey for you as a therapist, right? So I always tell my students and supervisors that we are the expert of, hopefully, the expert of the process, but we are not the expert of clients' lives. And there's a huge difference between that. And it's easy when you talk about it, but it's really challenging to truly be that and do that in therapy, because we all go to our sessions with all the different biases that we have, the social location factors, the like intersectionality dynamic that happens in our sessions, right? All these different things, and we all have definition of things, definition of values, right? Even though like we are not mindful of it, even though if you ask me, what has changed mean to you? Even if I cannot answer that, still, when I see something, the definition of good and bad, healthy and unhealthy, when I see a relationship, I have an idea about that, right? And as a therapist, you go to your session and you have a lot of different definitions and values, right? So having that stance of not knowing, and you're not the expert of their lives, meaning you are there, you are curious, you ask questions, and hopefully you are on this process, on this journey, that you are becoming mindful of your own biases and definitions, and you do not let them block your clinical judgment or the way that you are helping the client. So a lot of times that means, like, when I have conversations with my students or supervisors and they talk about their cases, I ask them, okay, what is your definition of change here? What is your definition of healthy here, right? Because they have this individual in their office who says, hey, my partner, I'm cheating on my partner. And out of a sudden, I feel like, oh my God, that is unethical. That is not, let me help you, let me fix you, let me tell you, And then even like sometimes it's just so funny because the client is even not there for that specific aspect of their lives. They are just talking about something else, and in the middle of that they mention something, and all of a sudden we're like, oh my God, that is just so bad, let me fix that for you, right? And then we need to have this conversation, that is it really what your client is looking for? Is it something that you feel like is wrong, or is it something that is harmful for other people, or is it some, those kinds of questions that, again, like when we are talking about it, they may seem easy, but in practice they are difficult. And I feel like having that not knowing position requires for all of us, even after we get our license, that in this country we don't need to have like supervision or consultation. Even then, keep having supervision and consultations, because we always have blind spots. We always think that, okay, I got this, I've been doing this for 10 years, so let's just go and fix the situation. But you really need to be humble and practice that cultural humility, and kind of like seek for help when you need to, or consult with your colleagues. The other thing that I think in having that stance of not knowing should happen is we need to expand conversations about societal context, about power dynamics, about what some people, they call third order change, right? So first order change, it's just shallow. We don't want that to happen in therapy. Second order change is like when we are, talking about underlying layers and, fundamental issues. And third order change is really, it really goes with narrative therapy. When you expand the conversation to the messages in our society, societal context, power dynamic, and seeing how different things, different factors can influence what you are seeing, the story or stories that you're seeing in a session. And again, like hearing them, taking perspective, hearing them from clients' perspective, not just your own perspective, because it's just so easy that I sit here and I tell you, you know what you're doing is wrong. Let me tell you what is right for your life. Does that make sense?
Yes, absolutely. Yeah, I love everything you're saying. I was kind of jotting down some things as you were talking.
Mhm,
One of the things that came up, I love this piece of just like the cultural humility piece,
mhm,
and how we always have to be aware. And one of the things that we've talked about in class is that sometimes there are some biases that we have that we know up front, but a lot of times that's not what happens. A lot of times it happens when we're sitting in therapy and a client says something and we feel our heart starts racing, we start immediate kind of going to, wait a second, we start to notice the changes in our body, and we think
mhm,
this might have been, this is something that triggered me that I wasn't expecting or wasn't prepared for. And so I love the idea of like constantly this constant conversation for the rest of our lives of working on kind of cultural humility, and this piece of that I think is so powerful with narrative of just being curious,
mhm,
right? So anytime you start to, that's my go-to. Anytime they're like, I don't know what to do with this, I don't understand this piece about them, I feel like I'm having a hard time kind of separating my own bias or judgment from something going on in my patient's life or the decision they're making. Get curious,
mhm,
get curious, reach understanding. And so one of the things that one of our students had said in class that I really loved was that one of the things that he really likes about kind of taking like the not knowing approach or kind of not being the expert in the room is that kind of lifts a burden off of you when you're walking into a room, to not feel like I have to walk in with this like backpack of knowledge, right, of all of the things that I'm the expert in, and kind of relieves a lot of that pressure to just sit down and talk with the person in front of you about what their lived experience is, and to kind of be curious about that. So yeah, I love that. The other thing I wanted to kind of bring up too, and I kind of highlight this always with my students, is this idea of kind of constant collaboration with your colleagues. I don't know how often I say this, that I've been practicing for 10 years or so, and I still consult with colleagues about cases. And that is not because I'm not a good, competent therapist. It's because that makes me a good, competent therapist. And
mhm.
so I think MFTs do this really well. But it's just a good reminder that the cohort model that students are in, it's there for a reason. It's, you start the process now of what it's like to lean on each other, and that will continue throughout your career. So
Exactly.
I'm really glad that you kind of highlighted that, because I'm super passionate about that too. Um, I wanted to talk through any kind of, because you kind of talked a lot about the expert, and I love that. I wanted to kind of get into maybe some examples or
Mhm, mhm,
cases that you can kind of share with us about
mhm,
times that you've used narrative, and kind of what that's looked like in the room. I know talking through it is not the same as watching it, but
mhm.
I think sometimes it can be helpful just to kind of get a, how does that kind of look like in like a real life example?
Sure. Before we go there, can I say one more thing about
Yes, please,
because
please, yes.
because I know that sometimes, I don't know about your students, but a lot of times for me, students, they ask like, okay, I get the idea of cultural humility. I get, what you're telling me, but what does it look like, when we are in
Yes.
the room with the client? And I like what you mentioned about, like, it's kind of like relieving that you feel like, okay, I don't need to go and know everything. And at the same time, sometimes students or therapists in the beginning of their journey, they have sessions with their clients, and they come back and they say, oh my God, I feel like I didn't do anything, right? I didn't do anything. So that's why I have this conversation with my students and supervisors, that this non-expert position is a lot of times about observation and good questions when we are talking about what does it look like in therapy. So you are there to have good observation, see patterns, see what's going on, hearing things, and you are there to ask good questions. A lot of times clients come to us and they are there for us to give them kind of like instant prescription, or fix
Mhm,
things, or
mhm.
change things over a night, stuff like that. That's about clients sometimes, but us as a therapist, at least we should know that we are not there for that, right? And again, like, another thing that is, I think, super important in that non-expert position is to just be open to feedback from clients. And because this is the argument between providing a safe space versus brave space. So a lot of times we talk about in therapy, we want to provide this safe space And we want people to feel included, all the different things that and then there's another argument which says in reality there is no 100% safe space, because we all, like, it's like driving. You are a good driver, you have all the skills, you are careful, but accident happens, so we can make mistakes. And then it's the idea of having a brave space, which means, like, if you make a mistake, if you say something that you feel like, oh, like I had my own judgment, or bias, or whatever, cultural humility, then you acknowledge the hurt or the pain, and you keep having conversation about it, and you're open to feedback from clients. So I think that non-expert position in therapy, it looks like, again, like, when you're having good observation and when you're asking good questions, right? What I'm hearing is blah, is that correct? Or I understand what you're saying. I'm also wondering if this other perspective makes sense to you. Or I'm hearing the things that you're telling. What would you prefer? Like, how would you prefer things to be? Right? So asking those questions instead of going with your own agenda that, what, this is wrong. Let me tell you what is right. Does that make sense?
Absolutely.
Yeah.
Yes, absolutely. No, I think thank you for adding that. That's so
Of course.
important. And the language too of, like, when I'm offering suggestions and using my expertise and what I'm seeing happening in the system, asking, like you said, kind of framing that to the patient to say, is this your experience? Does this make sense for you? If not, tell me what would be a better word for this, or
Exactly.
a better description of this. And just that approach alone is showing that you're not the expert in their life, right? That you're offering up expertise and what you're noticing about the system, but also allowing room for their feedback. Which can be nerve-wracking for a new clinician, right? But it's important, and over time, that I think that becomes you become a lot more confident in that the more you do it.
Exactly. And sometimes it drives also clients crazy because they're like, tell me the
You
answer,
tell
right?
me, right?
Right. And then
Exactly.
in those situations, I usually tell them, I understand this is like frustrating, but let's talk about the options that you have in mind and talk about consequences, right? So if you choose this option, let's have that clarification that these are the things, the consequences. So in that way, again, like, you're not just leaving clients alone, you are still helping them, but again, like, you're empowering their own agency instead of going with your own agenda.
Absolutely love that. Awesome. Thank you for adding that.
Of course. Your next question about examples, which I think is a great question. So a lot of times in my private practice, I work with couples, and specifically couples with chronic illness and cancer. And one way that narrative therapy is helpful with that is I really help them to rewrite their narratives. And for them, specifically with couples with chronic illness and cancer, a lot of times they're talking about past versus right now, and them versus others, that our relationship is like this, but our friends relationship, they're like this, or we are not used, we used to do XYZ, but now that cancer, or this illness is here, we cannot do it anymore. So all these different changes that comes with chronic illness or cancer, and I help them to try to, that acceptance of the, what is currently happening, but at the same time, like, what you're saying is about the past or about others. Let's, your new normal is different. So let's talk about this new normal, right? So even like that new normal kind of like term, like naming it like that, like, in my experience, is a lot of times helpful. That is just one example, but I also have one other example that I wrote it down, I wanted to read for you. And this is from my experience in integrative kind of like healthcare setting. So it's about a patient who survived a serious car accident and was suffering from PTSD. And I talked about this in one of my articles as well. So the patient told me about this specific event in narrative detail, and she had clearly become confused with the traumatic event. And the accident was part of her identity, right? So she referred to herself often as a car accident victim. So she seemed stuck at a time of the trauma and unable to break free despite a desire to do so. And I helped her understand that a significant portion of her feeling that she was a burden to her family after the accident came from societal message and remarks from others in her life. So that is the part that we want to, highlight with narrative therapy, right? We expand the conversation and we talk about where does that come from, right? So and that shows, that principle one with narrative therapy, that reality is socially constructed. So we also talked about how using the language of burden or victim shapes her experience and the interactions with others and herself. And this is about reality is impacted by language, right, in narrative therapy. Then I helped her in the grieving process and the externalizing of the event from her identity. So by separating from the event, the patient could grieve the event as something separate from the self and not be immobilized by it. So which is about, again, like that other principle in narrative therapy, that narratives helps us make sense of our experiences. Then I also validated her feelings and experiences related to the accident, even though they had changed over time. And this is about, there's no absolute truth, right? So we can always, talk about the truth and how the way that we are making sense of it is important for us. That is just one example. And again, like just to be different, that is it was not in a kind of like traditional care setting that you see clients
Yeah.
for 45 minutes, 50 minutes. That was like a 20 minutes kind of like
That's impressive. That's very impressive.
Thank you. But just one example that we can use narrative therapy in different settings and with different clients and with different stories and in different ways. It's just about, from my perspective, if we believe in it, if we are truly like practicing it, and if we have some knowledge and skills about the techniques, the principles, and the things that narrative therapy offers to us.
Yeah. So were you able to only see this person one time, or did you guys follow up in like the integrated care setting?
So I think we had 2 or 3 sessions, but it was not like a
Wow.
traditional like setting.
Yeah.
Yeah.
What was the biggest shift you noticed in her from like the first time you met toward the last time?
I think that empowerment in terms of I
Mhm.
am not, that quote, that I am not the problem is the
Yeah.
problem, and there's no absolute truth in terms of there's this problem and this is how it's going to impact my whole life from now on. There are
Yeah.
different ways to look at this, and there are different ways to make meaning out of it. Does that make sense?
Yeah,
Yeah.
yeah, absolutely. That's so cool. And it's
Mhm,
cool to hear about that. I know that when I was in an integrated care
mhm,
setting, we saw a lot of PTSD related to motor
mhm,
vehicle accidents.
mhm.
And so to be able to kind of hear your perspective from a narrative lens is really cool. And how powerful that would have been. And did I hear you say that there was a part where kind of her family was also kind of reinforcing kind of the narrative about the impact of the car accident kind of
Yeah.
on her?
Mhm.
And how do you think did you all talk specifically about how she can have those conversations with her family to kind of help stop that narrative from continuing, or was that something that you all weren't able to kind of talk in depth about given your kind of time limits?
So we've seen her family as well, like in that short time, which was really
Gotcha.
cool. But of course, that it would be very different, like if we had 10 sessions, or a
Hmm.
1 year kind of like weekly session.
Yeah.
But I think that whatever time and space we have with clients, if we can help them with the amount that we can help them, that is helpful from my perspective. And a lot of times,
Absolutely.
when for clients, when that shift or empowering starts happening, they can also, follow up on that themselves as well, like with the different resources that they have, right? Because not
Yeah.
everyone has access to therapy, every week.
Yep.
So
Yep.
yeah. Mhm,
That's awesome. That's
mhm,
an awesome example.
mhm.
As we're kind of wrapping up, are there any limitations that you have noticed? Is there any times where it wasn't effective for a specific population or maybe a certain complaint? And kind of if so, what were kind of your workarounds there?
Mm-hmm. Yeah, that's a great question. So I don't know if it's like limitation or challenges, but I think that one of the things that I've noticed is sometimes, especially like when you are a beginner on this therapy journey, it seems like narrative therapy, it has lack of agenda or kind of like recipe for
Yeah.
therapists. So like with sometimes other approaches like CBT, you have like
Hmm.
ABC, you have,
Manualize,
yeah,
exactly.
you
Hmm.
have different things, which is again like sometimes helpful, but with narrative therapy sometimes it seems more challenging because, as you mentioned, I feel like, okay, now I have 2 years of training, whatever, and now I'm here. What am I going to do, right? Then
Hmm.
there's nothing that I feel like I can suggest or I can, do, fix. Then what else I can do? So I think that that part is challenging. But one of the ways that I feel could be helpful over the time is, again, like when we have that conversation, when we are processing the self of the therapist, and when we are challenging the definitions that we have in consultation or supervision. a lot of times when my students, they tell me, oh, I had this session and I feel like I don't feel helpful. I feel like I'm doing anything. Then I ask them, what is the definition of change from your perspective? What is even like the definition of therapy? Why do you do therapy, right? Are you there to help them? Because we all say that, right? But what does that mean? I'm there to
Right.
makes their lives better. I'm there to like fix something. From my perspective, one of the definition of therapy is giving clients new experience. And that new experience could manifest itself in many different ways for clients, right? But we are there to provide that new experience, to help them have that new experience in therapy. And my other definition is that I think therapy is for clarification. So hopefully we are there to have more clarifications about things that we see, things that we decide about. It's not, therapy is not for clients to make the right decision from our perspective,
Mm.
to get their lives fixed from our perspective. So again, like to that limitation or challenge, one of the things that I found helpful is those conversations with the students about how they feel, the self of the therapist, and also their definition of things. The other challenge that sometimes I experience is if clients, they are differently abled in terms of cognitive, intellectual,
Mhm.
language skills, then it could be challenging because, as it says, like it's narrative therapy. You're
Right.
talking
Right.
about cognition, narrative, stories, language. So
Yeah.
sometimes that is challenging. And I know that sometimes in articles you read that should not work with clients with,
Mhm.
limitation in cognition, intellectual, language skills. But I'm sure that the conversation is like going on. And the other critique that I hear, or the challenge that I hear, is sometimes some professionals, they say like it's really hard to understand no absolute truth in
Yeah.
life, right?
Yeah.
It's really hard to just understand that and
Mhm.
just leave and practice based on that, because then it brings chaos and stuff like that. And I know that you had some conversations or comments about that, so we can continue that conversation. I just want to hear your perspective as well.
Yeah, it's so true. I especially think as like thinking back of when I was kind of a student therapist and just how anxiety provoking things are. And so when you go from learning kind of structured technique in therapy and models that prescribe, how I kind of describe kind of modern models, right? Is every person that walks through my room, I'm viewing in the same lens,
Hmm.
right? I'm viewing the problem the same way. I'm viewing the solution the same way. The techniques are going to be the same for each person, for each family, whatever it is, because it's just feels so much more cut and dry and formulated, kind of like you were saying with CBT and DBT and all of those other kind of manualized treatments that we know have so much evidence behind them.
Hmm.
And we can also talk about why they have so much evidence behind them, right? Because they are so manualized and cut and dry and much easier to study compared to something like narrative.
Hmm.
And so it's just, you can see why for a student clinician, they would be gravitating right towards something that feels like it's more formulated, and where there's specific questions that you ask on this session, and kind of it's laid out in a different way. And so it's helpful to kind of talk through just acknowledging that, right? Acknowledging that there's discomfort in that, and also providing space for students to recognize the value in the non-expert approach, and the no capital T truths is what we keep talking about in
Hmm.
class, and what is the capital T truth for me is not the capital T truth for you,
Hmm.
and what does that mean as a self of therapist, and what does that look like in the room. So yeah, I think it makes sense, I think, but we have to acknowledge, why that feels scary, and also acknowledge that there has to be space for understanding and learning about these different approaches that have so much value. um, and so it's really helpful to kind of hear you talk through that, and those kind of limitations and challenges, and someone that is an expert in narrative therapy, hearing you acknowledge that that can feel kind of scary, and at first, to feel like you don't, that everything is so open.
Hmm.
Possibilities are endless, which is such a positive thing, but when you're new, it can feel scary, when you're still doubting your skills and yourself as a therapist.
Yeah, yeah, exactly. I appreciate that you mentioned that. So as our mentors and big people in this field, they talk
Mhm.
about choosing a theory as like dating different, like dating people, right? So you're kind of like dating all these different theories until, you know, you choose someone. And as you
Mhm.
mentioned, a lot of times when students, they have that paper theory of choice, right? A lot of them, they talk about CBT, and some of them, they talk about, they choose CBT, as you mentioned, because it just feels so comfortable, right? It's like when
Right.
you're dating someone and you just choose the first person
The
because you
safe
feel
choice.
like,
Right.
yeah, I'm going to be alone
Yes.
for
This
the
feels
rest of
safe.
my life.
Yeah.
Right. And again, like, just acknowledging that this is happening, and also I have another option that I can, you know, keep dating, or, you know, even like keep
Yeah.
dating the wrong theory, whatever, you know, but still like providing that opportunity for yourself to see what feels good, what fits, what is a good fit, what is not a good fit, you know,
Yeah.
what is really aligned with the way that you see the world. That is what I keep telling my
Yes.
students, that the way that
Exactly.
you see the world, human beings, change, happiness, those things, they're going to help you in choosing a theory, because the way that you see the
Yes.
world should, you know, be aligned with how or what you do in therapy.
Yes, absolutely. I love that. I love that. I love the idea of the dating because it's like CBT, it's like the safe option, right? But there might not be a lot of passion there. Whereas you talk about narrative and especially narrative, I think even more so than solution focused. It just there's so much more intimacy, there. And so it's one of those things. One of the things we also talked about was one of the founders of narrative. I can't remember if it was Michael White or David Epstein, but he's saying that he thinks it takes about 3+ years in kind of consistent providing narrative therapy and consultation and watching video and having kind of peer critique to actually be able to kind of master, right, this approach. And so I say that to my students to say, don't feel so pressured when you
Exactly.
graduate to kind of have this nailed down. It's going to come with time, and it takes clinical expertise. It takes time. It takes seeing patients. It takes years and years of providing clinical care before you can feel like you really have a grasp on some of these approaches.
Exactly. I really appreciate what you mentioned, because I also teach theories, and I keep saying that to my students as well, because
Yes.
a lot of times they, you know, at the last session, they're like, oh my God, I don't know what I'm doing here. And I'm like, I would be surprised if you told me that you
I
know
would be
what you're
worried
doing.
if you did. Yeah.
And you just have this course to know the options out there, you know, what are some of the options out there,
Yes.
not to be masters in something, because that is just impossible.
Absolutely. Absolutely. I'm so glad. I'm so glad to hear that. Okay. I wanted to just, as we just have a couple minutes left, I know. I mentioned this to you and you brought it up a little bit when you were talking about externalizing.
Mhm,
But this issue has come up in our class where we've talked about this idea of affairs and you kind
mhm,
of hit on it, but I wanted to just kind of send home the point you were making, about this idea of if we externalize something that feels so egregious, right? Like an affair where it feels like it's very cut and dry from the outside world,
mhm,
where the problem is, who the problem is.
mhm,
What, as systemic thinkers, or what should our lens be as narrative therapists with something like an affair? And is externalizing the affair, is it taking away ownership from that particular person, I guess,
mhm.
that had the affair? Is it taking away ownership from them as we kind of talk about the value of externalizing? So I wasn't sure if you had any other thoughts on that. I know we kind of touched on it, but if you had any other thoughts, that was one of the things that stood out to my students as I'm trying to make sense of externalizing problems, but also in this particular case, it feels wrong to do that,
Mhm.
and so I was just curious at kind of what your thoughts were.
Sure. Speaking of narrative therapy and good questions, I'm glad that your students, they ask that such
They
good
do.
questions. That
Yes,
is great.
yes.
So it seems complicated sometimes, but I think that one way to look at it, in terms of externalization, and also that whole principle of no absolute truths, right? One way to look at it is, there's no absolute truths, and at the same time we have shared meaning, right? And shared meaning in terms of our agreement about, let's say, I don't know, harassment or sexual
Mhm.
abuse. Those things, they are wrong and they are harmful, right?
Mhm.
So we don't say there's no absolute truth, meaning that, okay, let's have this chaotic society and everyone, they can do anything that they want, and that is, you know, because there's no absolute truth, right? So we have shared meaning in a society, and that is how a society is a society. And at the same time, I think one other way to look at it is that, um, in other modalities, sometimes we have this kind of like framework that something is absolutely 100% wrong and there's no way that it's right? There's no way that it's functional. There's no way that it serves something in a relationship, right? So just wrong, cross it, remove it. But with postmodern theories and narrative therapy, externalization, or that shared meaning, we are talking about even things that from the different point of perspectives, we think that they are wrong or they are dysfunctional, or maybe there is a way that they are functional or they serve something in a relationship. Let's say with domestic violence, right? IPV, it's wrong, of course, that it should not happen, right? But let's say for a couple that they have domestic violence and then after that they have makeup sex or makeup whatever, right? So again, it's not saying that, okay, because of that, it's okay that they have domestic violence. We don't say that, but as narrative therapists, we look at it from different perspectives. So we say, this is what's happening. This is wrong, or this is, harmful in your relationship. At the same time, it seems like there's this other aspects that serve something in your relationship, right? So I think, again, like it's the kind of like a different view, a different perspective that we have and we take to see things and to talk about them. And in the example that you mentioned, I don't think it's about accountability. It's about how we talk about this story in terms of this happens and it's your fault, period, right? Or this happens and, let's talk about contributing factors, right? And it seems like this portion contributing factor is 99%, right? Whatever, 99.9, right? But let's talk about it with that language, and then still, we talk about accountability in our sessions with clients. But again, like the perspective, the way that we talk about it, it's different with narrative therapy. Does that make sense?
Yes, it really does. And what I love about what you said is that if we take that black and white approach about the affair is good or bad, we miss out on specifically the example you were giving about the intimacy, right? So something about that interaction, then creating intimacy for the couple, we miss out on that if we, right? We miss out on that context. And so, whereas from a narrative perspective, if we're able to kind of broaden and not just talk about it as black and white bad, but acknowledge, okay, the role that it plays in the relationship, and how do we replicate that in a way that we agree as a couple or as a family is appropriate, right? Rather than violence, right? And so, like, how do we replicate the feeling of whatever is happening there? How do we replicate that in a safe way that then also still promotes intimacy? And if we take that black and white approach and don't look at the context, or maybe that affair is triggering for us as therapists and we feel like we can't go there, we can't talk about it, those are all roadblocks, right? into being able to kind of really get help the patient, I think, move along. So I love that perspective so much.
Then we will have a lot of untold stories, right? That they are still like playing a role in a relationship or in something, and then we just choose to not see them.
Yeah, that's right. So tell me, okay, so this has been such an excellent conversation. I think it's so valuable. I'm so appreciative of your time, of your energy to kind of sit and talk with us for a few minutes about your expertise. And is there any kind of final thoughts or anything like that about narrative that you'd like to share with us?
First of all, thank you. I really appreciate this. This was so exciting for me, and I'm happy that we had this conversation. My final thought is that hopefully all of them, they choose narrative therapy. No, I'm just joking.
I'll send them to your YouTube.
That's such a postmodern perspective. But no, I just want to tell your students and students in general that I feel them. It is scary. It is like confusing in the beginning to see all these different things and choose among them. But I would encourage them to be patient with the process and just give themselves grace and the patience to get to know all these different things, theories, techniques, and see what feels better for them. And always, reach out when they have questions and, when they need to have conversations, because I think we have been there. So yeah,
absolutely. And still are sometimes.
Yeah, right. I know.
Well, thank you so much. Thank you so much for your time and energy today. I appreciate it so much.
Thank you. Thank you. And I hope that we have more conversations in the future.
Thank you.
Bye.
Bye.